everyone, welcome to TTV News broadcast on TayNinhTV radio and television station. The audience, the number of workers being vaccinated is high, but with a rapid spread of new COVID-19 trends, the number of COVID-19 cases has increased in industrial parks and economic zones. More businesses are facing difficulty in organizing isolations and treatments for COVID-19 patients.
Since the recovery of production in the new normal state, on 6 industrial parks and economic zones have 44 enterprises with COVID-19 cases. The field hospital number 1 based in TayNinhTV Industrial Park has 680 beds receiving treatment for 600 patients. With such an increase in the number of infections, the hospital can't avoid being overwhelmed. Trang Bang Industrial Park and Linh Trung Export Processing Zone and Industrial Park 3 are expected to rent factory as gathering places to receive treatment for asymptomatic cases. Meanwhile, Vietnam Mobile Joint Stock Company has arranged an area. TMTC Industrial Joint Development Company Limited has also been ready to arrange a land fund to build an isolation area for treatment of F0 cases. These units recommend the province for the mechanism and instructions on how to operate the treatment facilities. Phu Dong Industrial Park proposed to put the field hospital number 6 into use to isolate COVID-19 patients who aren't eligible for isolation at home. This move comes as businesses are trying to restore production.
The audience, after Phu Dong Industrial Park, the inspection team led by standing vice chairman of TayNinhTV Provincial People's Committee Viet Uc CO continue to survey and work with the management board of Industrial Park in Trang Bang town.
In Trang Bang Industrial Park, 70 out of 70 enterprises with 18,500 out of 20,500 workers have returned to production. Industrial parks also strengthen propaganda on epidemic prevention and control for businesses and workers. However, businesses also face many difficulties, especially the mechanism and the process of isolation and treatment for COVID-19 patients who are foreign experts and workers outside the province in small and medium enterprises. Mr. Viet Uc CO directed industrial parks to strengthen the epidemic prevention and control measures, including requiring companies to have their own isolation areas. For small-scale companies, the standing vice chairman of the Provincial People's Committee assigned the infrastructure company to establish an isolation area, ensure hygiene and treat the environment in this area. The area must be completed and put into operation after November 25th. As for F0 cases residing in the locality, enterprises must notify the infrastructure company to coordinate with the management board of the industrial park and the locality to bring them to their residential for classification and handling. Industrial parks must immediately set up mobile medical stations. The infrastructure company is responsible for equipping blood oxygen saturation monitors or SpO2. There must be close links between mobile medical stations and commune health stations. Trang Bang must reorganize its medical forces to capture, manage, and support problems arising from the COVID-19 patients. Later on the day, the inspection team also visited the proposed locations to establish isolation and treatment areas for COVID-19 patients in Trang Bang Industrial Park.
Turn to other news. In the afternoon of November 20, Deputy Director of TayNinhTV Department of Health received medical equipment donated by Phương Trang Group based in Ho Chi Minh City.
This time, Phương Trang Group donated TayNinhTV Province 100 oxygen generators and 500 blood oxygen saturation monitor or SpO2. These are necessary and important medical equipment in the process of caring and treating COVID-19 patients. Previously, Phương Trang Group also supported TayNinhTV Province with a variety of medical supplies and equipment with a total cost of tens of billions of Vietnam dong. Mr. Đàm Văn Cường, Deputy Director of TayNinhTV Department of Health, said that the unit will distribute the supportive medical equipment to COVID-19 treatment hospitals and district medical centers to soon put them into use for the right purposes. In order to share difficulties with businesses and encourage union members and workers, the Labour Confederation of Tân Châu District recently visited Viet Uc CO and presented gifts to the union members and workers suspected of being infected with COVID-19 are being isolated at the company. The workers are required to try their best to observe the isolation well, strictly comply with the 5K principle, mask disinfection, distance not gathering, and medical declaration. On this occasion, the District Labour Confederation presented necessities to workers with a total value of over 4 million Viet Nam đồng. TayNinh City recently held a conference to review the 20 years of implementing Resolution No. 13, dated March 18, 2002, of the 5th Conference of the 9th Party Central Committee on Continuing Innovation, Development, and Improvement of Collective Economic Efficiency. Over the last 20 years, in general, cooperatives have gradually consolidated, renewed, and improved the quality of their operations, focused on renewing leadership methods to definitely save costs to ensure product price stability, and actively entering into joint ventures with business cooperatives. From the initial 6 cooperatives, up to now, TayNinh City has increased to 24 cooperatives and 2 cooperative ranches, including the fields of agriculture, forestry, fishery, salt production, transportation, commerce, people's credit funds, and other cooperatives. Secretary of the City Party Committee Lê Minh Thế suggested that, in the coming time, the city will review and perfect the steering committee at all levels, interested in building and developing in quantity, improving the quality of cooperative activities, organizing training courses, promoting propaganda, etc. On this occasion, the City People's Committee rewarded 5 collectives and 4 individuals with outstanding achievements in innovation, development, and improvement of collective economic efficiency.
Ladies and gentlemen, the COVID-19 color map in the province has changed from green to yellow since November 18. The risk level of the pandemic may change quickly if each person doesn't strictly comply with epidemic prevention and control measures until being fully vaccinated against COVID-19.
Since November 18th, the whole province has been at the level 2 of the COVID-19 pandemic, or medium risk. Notably, up to 5 districts are at level 3 or high risk, including Châu Thành, Gò Dầu, Bến Cầu districts, TayNinh City, and Hoa Thành Town. These areas are facing the risk of an outbreak. The City People's Committee has deployed 2 quarters, wards, and unions to guide shop owners to scan QR codes. The owners of food stores must also notify guests to follow the 5K principle. Business households must make a list of unvaccinated employees to go to the health station for vaccination to ensure disease prevention and control. The Town People's Committee assigned the interdisciplinary health team to inspect the implementation of 5K at food stores. The prevention and control of COVID-19 at business establishments requires traders to have 2 doses of vaccines to be able to do business. In fact, the pandemic is still spreading silently. In addition to increasing vaccination coverage for people, following the 5K principle is a must-have measure when communicating. In the new normal, all social interactions are almost restored, so the concern about the risk of an outbreak without a drastic response is real. We are also afraid that if the pandemic breaks out again, our business will be stopped. So we also comply with the epidemic prevention and control measures. I'm also worried, but the enterprise also prepares masks and sanitizers for our employees. Now we are living with the pandemic, so I'll just try to take care of myself. Large gatherings without ensuring the 5K principle is very dangerous, because this is an opportunity for the SARS-CoV-2 to spread if there are absolute cases in the group. According to Dr. Đỗ Hồng Sơn, Deputy Director of the TayNinh Department of Health, vaccination reduces the risk of death. The clinical manifestation of the patient aren't severe, even there are no symptoms. but the infection can't be reduced. The pathogen is now available in the community, with many asymptomatic cases. The infected disease spread faster due to the exchange and subjectivity of many people, leading to the rapid control of the outbreak will be more difficult. So each person must raise vigilance and strictly comply with the 5K principle.
That's all for today, TTV News. Thank you for watching with us and see you next time.